I'm Dr. Sukrith Shetty. I'm a surgical oncology at the NMC Specialty Hospital in Dubai. I've been with the group since the last 14 years. I set up the department in Abu Dhabi in 2002. So, being a breast cancer awareness month this month, so short little notes for women and also men about breast cancer. As you all know, you've been hearing the news that everybody has to be breast aware. Women above 40 needs to start screening. And the warning tips are any lump, painful or painless, which is felt by a lady, should be seen by a doctor. Women should also get into the habit of checking themselves every month, a week after your periods. There are some very good sites on the net to show them how to do a self-examination. Otherwise, a doctor who is used to this will definitely be able to help. So what does a lady do once she feels a lump? She needs to be seen by a doctor, preferably a person who has a little experience in dealing with breast diseases. Then the doctor might ask for some tests like an ultrasound or a mammogram if that lady is of the appropriate age. Important thing to note here is there has been a scramble for mammograms, and a lot of young ladies seem to be coming to the hospital asking for a mammogram. Mammograms are not going to be helpful in a young lady because the breast is dense and we don't get that much information. So a doctor might decide to do other tests like an ultrasound, or in a rare situation an MRI of the breast. So once a lump has been picked up, it is the doctor's decision whether he wants to do a further test on that. And these will usually involve a biopsy. And these biopsies are done by special needles with the help of the ultrasound guidance so that the exact tissue is picked up. And once we have a diagnosis of what this lump is, the treatment is done accordingly. If in fact the lump turns out to be a malignant lump, the lady will further undergo some further tests to check for the rest of the body to see if there has been any spread, and a plan for surgery is discussed with the patient. These surgeries are better done by a person who is experienced in handling breast cancers, preferably a surgical oncologist or a breast surgeon who has been trained specifically to handle malignant diseases of the breast. So the options of surgery are discussed with the patient once we know that the disease has not spread outside the purview of the surgery. These options could be just removing the lump with sampling of the lymph glands, removing the whole breast and reconstructing it in the first instance or a secondary instance. Present day, the immediate reconstruction and the implants are much more easy and comfortable for the patient, and that is what is being offered more often these days. Following this, the lady might also require further treatments like chemotherapy and radiation, and they are referred to the medical oncologist and radiation oncologist accordingly. Now, who should be screened for breast cancer? We usually start the screening at the age of 40 for all women who don't have any problem regarding the breast. This is called screening. A screening is done when a person is tested where she doesn't have any problem. If there is a problem like a lump, that mammogram is called a diagnostic mammogram and not a screening mammogram. So screening is started at 40, and we might decide to do it on alternate years till the age of 50. From the age of 50 onwards, the screening becomes mandatory. Yearly, we continue this till at least the age of 65. So all women, men who are involved and can make a decision on this should be encouraged to help the people come forward and have the screening done. Thanks.